So, welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, the owner and a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners, create custom medications, and help our patients get better. In today's episode, we have Dr. Eva Coleman from Harmony Medica in Reston, Virginia. And we're going to continue our discussion from the last episode on chronic stress and how it alters our health. And so, Dr. Coleman, for our new listeners who are listening to this particular episode, could you please introduce yourself?
Hello to everyone, and thank you for attending this educational event. I am Dr. Eva Coleman. I am internal medicine, anti-aging, regenerative and functional medicine doctor, and I'm practicing in Reston, Virginia. Yes.
So, Dr. Coleman, this has been a banner year for stress. Schools have been shut down, businesses have closed, people have lost their jobs, and now we have to potentially celebrate holidays with our family members. This is all very stressful and it leaves a long lasting effects on our health. When we were getting ready for this podcast, I asked you, could you share with us, what are you seeing in your practice right now during this time? And you said more and more people are fatigued, and it's all from the stress that we're enduring this time. So we decided to, in this episode, share some cases, couple different cases, and hopefully that'll bring that listeners can see or feel in the shoes of these cases what to expect. Before we begin, you said you're an integrative physician. Could you explain to the listener what is an integrative physician and what's different from our primary care doctors that we go see? If you could explain that.
Integrative medicine is like healing-oriented medicine. It takes a patient as a whole person. So we treating in primary care, internal medicine, family practice. We are trained to diagnose the disease and treat that with the medication. We don't have enough preparation in preventative medicine and in ways to actually check and follow more chronic diseases like chronic fatigue and fibromyalgia or chronic pain. We just give the medication, we prescribe the medications, and it's mostly symptomatic treatment. Yes, functional integrative medicine is treating the whole body and is looking for the origin of the problem. So you need to do more testing, in-depth evaluation to find out what is the problem. Sometimes we need to check genetic components and see if the patients have some problems, some mutations, so they don't detoxify properly. They have gastrointestinal problems, and you have to actually talk more about nutrition and lifestyle changes to make the person healthier and being able to overcome their problems.
Great.
So I have been practicing primary care for more than 15 years, and I have been doing what I was trained. So, diagnosing patients and giving them medication. But I found that many of my patients, they really didn't improve. And a lot of women, for example, with hormonal imbalances, they have problems which are not addressed properly. So being a woman and seeing all these cases, I found that I need to expand my knowledge, and I enter anti-aging and functional regenerative medicine fellowship, and that helped me to broaden my knowledge and apply more evidence-based medicine.
Okay. So thank you for explaining that, because, you and I say these terms, functional medicine, integrative physician, but, to many people out there don't know that, you take a deeper dive into the person's and why it's happening in the whole body. So thanks for explaining that. So let's begin. A disclaimer before we begin, actually, is that the cases that you're going to be discussing in this episode, they are real cases, but the names have been changed for privacy reasons. So if you'd like to go ahead and start with the first case you want to discuss with the listeners.
Okay. Betty was a never high energy person. Okay. And she was frequently during her childhood, frequently sick. At her university, she was struggling from chronic fatigue. And the job she took, it wasn't that what she was thinking it will be. So in the first month of her job, she got so many on calls, and she was working prolonged hours, and her schedule was always changed. So she couldn't adjust to that, and that affect her sleep pattern. And she couldn't anymore sleep. She had a problem with following sleep. She was constantly fatigued. She was feeling most of the time kind ill. And her memory and her patience were short, and she became more socially withdrawn. Okay, and all Betty wanted at the time just to, get away from everyone and put the cover over her head and sleep until her energy will return. So Betty actually took too much on herself, and it was beyond her limits. So she was referred to the staff psychiatrist, and after evaluation, she was diagnosed with depression. But she didn't feel good physically, so she came to me, and she wanted to be evaluated for her physical symptoms and maybe hormonal imbalances. And we started treating her. So we did a blood work, we did extensive physical exam, and we did mammogram and pap smear and things, and we did hormonal evaluation with Dutch test. After all that, we found that Betty was struggling from adrenal fatigue. And we started adrenal protocol with certain herbal medication, which are modulating the cortisol release, in addition to relaxation technique, meditation, yoga. And unfortunately, she needed to change her job and decrease her hours of working. So Betty is an example of somebody who has marginal adrenal reserve to begin with. And not too much it was needed for her to become severely fatigued and overwhelmed. So there are genetic predisposition, there are congenital differences in adrenal insufficiency, resiliency. For example, children born to mothers already suffering from adrenal problems, these children are already experiencing from the start severe stress, and they are prone to develop more adrenal problems.
So I got two questions for you. And one of them is, when you say adrenal fatigue, could you explain to us a little bit about what do you mean by adrenals? Like, if it, great, you got a slide. All right. Okay.
I got a slide. Yes. Yeah. Well, we talk about hormones and glands. Yes. Well, we have a lot of glands in our body: thyroid gland, adrenal gland. In our brain, we have pituitary gland, and they release hormones. Some of them are major hormones, some of them are minor hormones, and they actually the hormones are messengers that are traveling from one place to the cells, and from cells to the brain, and that's how they work. So they manage function of our body. So adrenal gland is a very small gland, is located on the top of the kidneys near the spine. There are very small glands, about 3 to 5 grams, and this depends if it's women or men. Of course, they have heavier. And they are located in very close proximity to major artery, aorta, and vein, like vena cava. And this clever location is very helpful, because when they are releasing hormones and stimulating hormones from your brain, released via blood to the adrenal gland, it allows that very rapid response to hormone messenger, like adrenocorticotropin hormone released from pituitary, and that stimulates release of the, for example, cortisol in right amount, okay, and very rapidly spread to the major organs. So adrenal glands are situated very close to major organs like kidney, liver, pancreas. And so that's how they work.
Okay.
And I have a picture, just a moment.
Oh, okay.
Oh, that's how it looks. Okay. Yeah.
Okay.
So, and they are, let me just add one more thing, because
Sure.
we're talking about adrenal hormones. So we have several hormones released from the adrenal. The most known, famous, and important is cortisol. Yes, and is responsible for many functions. Is for the utilization of carbohydrates and fats, for the energy production, for the sugar regulation, has anti-inflammatory and immune modulating effect, and affects our cardiovascular and gastrointestinal system. So it's very important hormone. Other hormones is aldosterone, which is regulating sodium and potassium and fluid volume. And there are other hormones like DHEA, and which is like aging hormone, is antioxidant, is responsible in tissue repair. And sex hormones, actually after menopause, women produce all their sex hormones from adrenal glands, like pregnenolone, progesterone, estrogen, testosterone, adrenostenedione.
Okay. So that's a pretty good explanation there of the adrenal glands and all the hormones it secretes. One of the things you mentioned while you were talking about Betty was that you did a Dutch test. Could you explain what is a Dutch test and why do you use it or in your practice?
Dutch test is advanced hormone testing. Is a laboratory developed by scientists and physicians in Oregon, and they are doing a very good job with that. And what are benefits of that? So they developed this unique testing method. So you need a dry urine sample, so 5 samples. It's easy to do, it's much easier than saliva test, okay? And over the top, what gives us better information, because it shows us all the metabolites of the hormones, okay? And if you also checks the sex hormones and their metabolites, which is very important information. Other things, for example, blood work, it doesn't allow to check for diurnal variation of the hormone release, and that's very important, for example, for cortisol.
Gotcha. Okay. So thank you for explaining that, because I've heard of the term Dutch test, but this is helpful on why you use it in your practice. So, do you want to talk about your second case?
Yes, let's go and talk about Kathy. Okay, Kathy was a mother of four, and she always wanted children, and she always also wanted career. So being self-employed, in addition, that wasn't easy task, yes, and she had very little time to spare, and she had. She really never recovered between her kids, and over the top, she had a career going on. Kids starts growing, and she became even more involved with social activities, school-related activities. There was very little time left to spend, and it was always with family. And that was a tension between a husband and her. But she continued pushing herself with drinking a lot of coffee, strong tea, and constantly eating sweets. And Kathy became more irritable, chronically tired and stressed, and finally she developed irregular menstrual period, although she was far from menopause. And developed more PMS symptoms. So that was more irritability, dysthymia, and sleep problems, and night sweats sometimes, or even hot flashes. She started gaining weight, and mostly was around her waist. And she started feeling really exhausted, and especially in the afternoon or in the evening, she was not able to finish her daily activities or work. So Kathy went to her primary care physician and explained her situation. They did blood work, they did all the screening tests, and everything was fine. They told her only sugar level, a fasting sugar level was a little bit low, but otherwise everything was fine. So Kathy came to me, okay, and we did physical exam and additional blood work, whatever was needed, and we did hormone evaluation with Dutch test, and we found that she had adrenal fatigue and early perimenopausal changes in her hormonals. So there was hormonal imbalance in her sex hormones. Okay, so she was basically in perimenopause. She was started on healthy nutrition and relaxation technique like yoga, meditation. She shared her work with her husband more and hire more people to help her in her work, so was able to take care of herself. And she was constantly, slowly improving, but we decided at one point that it would be beneficial for her to start hormonal replacement with bioidentical hormones, with progesterone and testosterone, because she had very low libido and she had all the signs of progesterone deficiency. So we started her on bioidentical hormones, and after a while, she started feeling better, and she was able to start good exercise program, and she was continuously eating good nutrition, high in cruciferous vegetables and proteins. And after about 1 year, we were able to stop her hormones, and she was able to continue herself with just good lifestyle and supplements.
Gotcha. So, with Kathy's case, I think there's certain things you mentioned that a lot of us can relate to, whether it's drinking coffee or, the stress that helps makes us gain weight. Dr. Coleman, although both the cases were involving women, but this can be the same thing can happen to men too, right?
Yes, yeah. Well, yes, I saw a lot of men with similar problems, and they have always trouble to come with that because they think this is not right. I'm just tired. Yes, and the men are thinking differently. So when they come, they already are in severe stage of adrenal fatigue. Okay, and they have all the physical symptoms and frequent infections and things. So they just cannot deal with that anymore. Women have tendency to take care of these things earlier.
Gotcha. So I see you have
Yeah.
a slide up
Well,
for some
so
symptoms.
yes, so that's how you say in my cases there are, what is the most important symptoms, the most troublesome, everyone complain is chronic fatigue. Okay, so of course could be related to many different things. So that's why you need a good physical exam and blood work and evaluation to make sure that you are not overlooking something. But that's the most important. A morning exhaustion, limited afternoon perk up, feeling unrested even after sleep. So people sleep 8 hours and they wake up and they are tired. They cannot follow sleep. They weight gain, usually in the middle, on the side of your face. Decreased muscle mass, reduced tolerance to stress, so they are very irritable and anxious. They develop depression. They are forgetful. They have poor memory, concentration. They have like foggy thinking and low libido, thinning hair or losing hair. Sometimes they can experience even joint pains, and they have more allergic reaction. They become like reactive to everything. They used to eat everything. They never had a problems. Now they have a funny reaction, or they feel really tired and foggy next day after eating certain kind of food. Increase in infection, in chemical sensitivities, and what is characteristic, usually people with low cortisol, and they have cravings for salty and sweet foods. So these are the people. I had a picture. That's how it looks. Okay. So it's
Yeah.
not just I'm being tired, because
Yeah.
oh, I am tired too. No, you are basically dragging. You cannot, push yourself. And sometimes these people, they are ashamed to talk about it because they don't want to be called lazy or,
Well, so
yes.
in drug,
Yeah,
in,
I have also mentioned, we were talking about these two cases, and they are lifestyles leading to adrenal fatigue. So many times people come to me and they are working, in very extremely unhappy situation. They have this malignant boss, which is like every morning they go to work and they feel like not in their stomach, and they really don't like, and that's going on for years. That can cause fatigue, chronic fatigue. Also people who have their own businesses and they are struggling with the businesses developing, that usually takes few years. Over the top you have a family house, and you are perfectionist, that's add to it, because we cannot do everything. So single parents, university students, drug, alcohol abusers, also people who are working in alternating shift. They have to frequently adjust their sleep schedule, which is impossible to do, and they develop hormonal imbalances. Also people who are all the time workaholics, all the time work. There is not balance between work and relaxation. Many times mothers, well, they don't work, they sit at home, but they have 3-4 kids, and there is so much to do, and they are overwhelmed, and they don't have support. Okay. Lifestyle components leading to adrenal fatigue, like we were mentioning with the cases, is lack of sleep, poor food choices like fast food and not eating enough vegetable or not good amount of proteins, using a lot of food and drinks which stimulate when you are tired, like coffee, like these energy drinks, staying late at night, so working at night despite your fatigue. If that is going on for a long time, that will affect your adrenal function. And constantly driving yourself, so trying to be perfect and not having balance in the life, this is a major problem.
Well, seems like in both the cases and the lifestyle changes, I guess we need to recognize what the external stresses are that can cause us to be exhausted and make us unhealthy, and then to get back to the right path of better health, and better energy mentally and physically. We just have to reduce the stress, which sometimes is easier said than done. And having an integrated physician like you on board can get us there to the path of wellness. And did you want to review this particular slide, Dr. Coleman? Or
I think I just mentioned, some of the events can lead to adrenal fatigue, which we already, I think, talks. So it was cases with too much work and work crisis at work or at home. Any other severe emotional trauma, which is going for a longer time. Also death of close family member or friend, close friend. Also major surgery can cause that too, and infection, repeated upper respiratory infection actually can do that. Even one time you have, for example, pneumonia, which is taking a long time to recover. If you have already a stress adrenals, it can put you in adrenal more severe problems. Serious burns, head trauma, of course, loss of job and sudden changes in financial status, relocation, moving to new places, no friends, no family, people are lonely and stress. Also chemical exposure, repeated exposure to chemicals can do that, and drug and alcohol abuse.
So, Dr. Coleman, a lot of information you reviewed and what could lead to adrenal fatigue. What are some key things to look out for, or what are the causes of stress and adrenal fatigue? Now, how can someone reach you or make an appointment with you?
You can go to my website, www.evacoleman.com, and you can make appointment yourself. Or you can call me 703-260-1600. And I am located in Reston, Virginia. I have a small practice, and I take a lot of time with the patient to figure out what's going on and get to the root of the problem and treat that.
Well, you and I have worked together for many, many years, and I can definitely attest to you. You sure do take your time with the patients, and they get better. I am Jay Gill, and I can be reached at j@compoundingcenter.com for any questions or comments on this episode. And this episode, or this is just for informational purposes, and it's not for any diagnosis or treatment purposes. And lastly, please subscribe to our YouTube channel or our podcast, The Compounding Center Connections, and stay tuned for our upcoming episodes. Thank you.
Thank you.